Understanding and measuring patient experience of needling for hemodialysis.
What is haemodialysis?
It's a form of treatment for people with chronic kidney disease. With haemodialysis, the patient's blood is cycled through a machine which removes toxins and wastes from the blood. Most people have dialysis needles inserted into specially formed veins and arteries called a fistula or graft. Patients call this step needling.
And what about needling? How much is this going to hurt?
Needling isn't pain-free, but should not be extremely painful. For many patients, fistulas are recommended over central lines because they have less risk of infection.
Until recent years, very little research has examined patient experience of needling. A team of researchers set out to explore patient experience of needling and find out what impacts it. Then they aimed to develop a questionnaire to measure this experience to guide patient-focused care. This research involved patients as part of the team at every step. The research team began by interviewing 41 patients needled for hemodialysis. Patients spoke about what made their experiences good or not so good. The research team analysed all their experiences and mapped out needling and what influences patients' experiences.
Firstly, it recognized what needling means to patients. It's necessary and a key part, yet often painful, and it can vary day to day. Secondly, the research defined the aspects that lay the foundation for each needling. These were the health of the fistula or graft, steps in needling, patient, needler, and organizational context. The organizational context sets the background for needling. Patient said staffing and management decisions impacted needling experience. For the fistula or graft, characteristics and problems, including being deep, narrowing, and clotting, drove needling decisions and led to worry about the future. Next, patients described aspects of the clinical procedure that affected needling, such as access to pain relief for needling, problems with placement, like multiple attempts, and how needles were removed and dressed. A key aspect was the needler, or who connects you to the dialysis machine. Patients commented that a needler's individual techniques, experience, skill, and knowledge of you and your access was important. For the patient, how they felt on the day, both physically and psychologically, was important. Feeling unwell or stressed often led to tough needling, which could quickly cause heightened anxiety and worry. Thirdly, it identified two main ways that influence needling. These two influencers are so important that they may override any of the foundational elements. The first is learning through experience. The key areas of learning were about preferred levels of involvement and knowledge around needling, figuring out resources for supporting needling, from pain relief creams to meditating to distraction techniques, adapting to changes, and how patients talked about themselves in relation to needling. Each of these can help or hinder needling. Often there are two people at the heart of needling, the needler and the patient. Patients said just how important the mutual exchange of confidence, empathy, and trust was between them and the needler, and how that impacted their experience.
Morris, a needling patient, said, "It's all to do with confidence and empathy."
Layla, another patient, said, "Having a good level of trust with your nurses is really important." Based on these findings, patients, researchers and clinicians set out to create a questionnaire so that patient experience of needling could be measured and show areas that can be improved. The questions address areas of needling patients said were important to them. They were tested in further interviews with patients and then in 2 rounds of surveys with over 500 patients.
This resulted in a 28-question Needling Patient Reported Experience Measure, or NPREM. The questionnaire is freely available so that kidney teams and patients can better understand what drives patients' needling experience.
To get more details about these research findings, follow this link, which includes summaries and scientific reports.
Needling matters. If you have concerns about how to needle or how others are needling you, please speak to a member of your dialysis team.